Over 60? These 5 exercises fix back pain better than walking. If you are over 60 and you wake up every morning with stiffness in your lower back, if standing for too long hurts, if walking doesn't really help the pain anymore, then this message is for you. And I want you to listen carefully, because what I'm about to share can genuinely change how your back feels day after day. Most people over 60 are told the same advice again and again. Just walk more. Walking is the best exercise. Go for a walk and your back pain will improve. But here's the truth, and this is important. Walking is not bad. But walking alone is often not enough, and for many people, it can actually make back pain worse. Why? Because back pain after 60 is usually not caused by lack of movement. It's caused by weak muscles, tight joints, poor posture, and loss of stability around the spine. Walking does not strengthen the muscles that protect your spine. Walking does not restore lost mobility in your hips. Walking does not wake up the deep core muscles that hold your back together. That's why so many people say, "I walk every day, but my back still hurts." So today, instead of more walking, I'm going to show you 5 simple exercises that work better than walking to fix back pain after 60. These exercises are gentle. They are safe. They require no gym, no machines, no floor movements that are hard to get up from. And most importantly, they target the real reasons your back hurts. Before we begin, let me say something very clearly. If you have severe pain, recent surgery, or a medical condition, always talk to your doctor first. But for most people over 60, these movements are not only safe, they are exactly what your body is asking for. Now let's start. Exercise 1. Standing pelvic tilt. This exercise looks simple, but it is one of the most powerful movements for back pain relief after 60. The pelvis is the foundation of your spine. When your pelvis is stuck in the wrong position, which happens to almost everyone as we age, your lower back is under constant stress. Walking does not fix this. But this exercise does. Stand tall with your feet hip-width apart. Knees soft, not locked. Place one hand on your lower back and one hand on your lower belly. Now slowly tilt your pelvis forward slightly, arching your lower back just a little. Then gently tilt your pelvis backward, flattening your lower back. Move slowly. No force. No jerking. As you do this, imagine your pelvis rocking like a bowl of water, forward and backward. Breathe normally. This movement re-educates your spine. It wakes up deep stabilizing muscles that have been asleep for years. Most people over 60 have lost the ability to control their pelvis. When you lose that control, your back takes all the load. Do this movement for about 1 minute. Slow, controlled, comfortable. Already, many people feel relief, because pressure is being taken off the lower spine. Exercise 2. Supported hip hinge. Back pain is very often hip pain in disguise. When your hips stop moving properly, your lower back is forced to bend, twist, and compensate, and that leads to pain. Walking keeps hips in a very small range of motion. This exercise restores the movement your hips were designed to have. Stand facing a wall or a sturdy chair. Place your hands lightly on the support. Feet are hip-width apart. Now push your hips backward slightly, as if you're closing a door with your hips. Your knees bend just a little. Your back stays long and neutral, not rounded. Then gently return to standing. This is not a squat. This is a hip movement. Move slowly and smoothly. You should feel the movement in your hips and the back of your thighs, not in your lower back. This exercise teaches your body to bend the right way again. When your hips move well, your back relaxes. Do this for 8 to 12 repetitions. Over time, this single exercise can dramatically reduce daily back strain, especially when standing up, sitting down, or lifting light objects. Exercise 3. Standing core brace. Many people think core exercises mean sit-ups or planks on the floor. That is not true, especially after 60. Your core is meant to stabilize your spine while you are standing, walking, reaching, and living your life. This exercise activates your core the way it's meant to work. Stand tall. Feet hip-width apart. Now gently tighten your abdominal muscles, as if you're preparing for someone to poke your stomach, but lightly. You should still be able to breathe and talk. Hold this gentle brace for 5 seconds. Then relax. That's it. No movement. No strain. This teaches your deep core muscles to support your spine automatically. Walking does not do this. This does. Repeat this 8 to 10 times. As these muscles wake up, your back feels more stable, less tired, and less painful during the day. Exercise 4. Heel-to-toe balance shift. Balance and back pain are closely connected. When balance declines, your body stiffens. Your back tightens to protect you from falling, and that constant tension causes pain. This exercise improves balance and relaxes the back. Stand near a wall or chair for safety. Place one foot slightly in front of the other, heel touching toe if comfortable. Now gently shift your weight forward and backward between your feet. Small movement. Slow movement. Keep your chest tall and your breathing calm. This wakes up stabilizing muscles in your legs, hips, and spine. It teaches your nervous system that you are safe, and when your nervous system feels safe, pain reduces. Do this for about 1 minute, then switch feet. Many people notice their back feels lighter and freer afterward. Exercise 5. Gentle standing spinal lengthening. As we age, the spine compresses. Discs lose hydration. Posture collapses. Walking does not decompress the spine. This exercise does. Stand tall. Feet grounded. Imagine a string gently lifting the top of your head toward the ceiling. Do not force it. Just lengthen. Now raise your arms slightly outward, palms facing forward. Take a slow breath in, feeling space between your vertebrae. As you breathe out, keep that length. Hold for 10 to 15 seconds. This reduces compression, improves posture, and takes pressure off sensitive spinal structures. Repeat 3 to 5 times. This simple movement alone can reduce daily back discomfort significantly. Why these work better than walking? Walking is repetitive. It works the same muscles in the same way. These exercises do something walking cannot do. They restore lost movement. They strengthen weak stabilizers. They retrain posture. They reduce nervous system tension. That's why they work better. And here's the most important part. You do not need to do all 5 at once. Even 5 to 10 minutes a day is enough to start seeing results. Consistency matters more than intensity. How to use these exercises daily. Do them in the morning to reduce stiffness. Do them in the evening to relax your back. Do them before walking, not instead of walking. Walking becomes more comfortable after these exercises, not before. Most people notice improvement within 1 to 2 weeks. Better posture. Less pain. More confidence in movement. And that confidence is powerful. Because when you stop fearing movement, your body heals faster. Now let's talk about something very important that most people never hear about: back pain after 60. Pain is not just physical. Pain is also neurological. What that means is, your brain plays a huge role in how much pain you feel. As we get older, especially after years of discomfort, the brain becomes overprotective. It starts sending pain signals even when the body is safe. That's why sometimes your back hurts even when you're not doing anything wrong. That's why scans often show normal age-related changes, but pain still exists. Walking does not calm the nervous system. But the exercises you learned in part 1 do. When you move slowly, with control, and without fear, your brain learns something very powerful. I am safe. And when the brain feels safe, pain decreases. This is one of the biggest reasons these 5 exercises work better than walking. Now let's go deeper into how to use these exercises correctly, because how you do them matters just as much as doing them. First, never rush. Rushing movements tells your nervous system that something is wrong. Slow movement tells your body that everything is under control. Second, never push into pain. Mild stretching discomfort is okay. Sharp pain is not. Pain is not weakness. Pain is information. Listen to it. Third, breathing matters more than most people realize. When you hold your breath, your body tightens. When you breathe calmly, muscles relax and joints move better. Every exercise you do should be paired with relaxed breathing. Now let's talk about a common mistake people over 60 make with back pain. They try to fix their back directly. They stretch the lower back aggressively. They twist it forcefully. They massage it endlessly. But the back is rarely the real problem. The back is a victim. The real issues are usually weak glutes, stiff hips, inactive core, poor balance, collapsed posture. That's why walking doesn't solve the problem. Walking avoids these weaknesses instead of fixing them. The 5 exercises you learned quietly correct these issues without stress. Now let me explain what happens in your body when you practice these exercises consistently. After about 1 week, stiffness begins to reduce. Not completely, but noticeably. Getting out of bed feels easier. Standing up hurts less. After 2 to 3 weeks, posture improves. You start standing taller without trying. Your lower back no longer feels like it's working all the time. After 1 month, daily pain reduces significantly for most people. Not because the spine changed, but because the muscles supporting it woke up. This is real, lasting change, not temporary relief. Now let's talk about walking again, because I don't want you to misunderstand. Walking is not bad. But walking should be the result of good movement, not the solution. If you walk with weak hips, poor posture, and inactive core muscles, you reinforce the problem. But if you do these exercises first, walking becomes enjoyable again. Your steps feel lighter. Your back feels supported. Your confidence increases. That's how walking should feel. Now I want to talk directly to those of you who feel afraid to move. If you've had back pain for years, fear becomes part of the pain. You might think, what if I make it worse? What if I damage something? What if this never improves? These thoughts are understandable. But here is something you need to hear clearly. Your body is adaptable at any age. Even after 60. Even after 70. Even after 80. Muscles respond to gentle training. Nerves respond to calm movement. Joints respond to regular use. The body does not stop adapting, it just adapts more slowly. That's okay. Slow progress is still progress. Now let's talk about how often you should do these exercises. Ideally, once a day. But if that feels like too much, start with every other day. Even 3 times a week can bring results. This is not about perfection. This is about consistency. 5 minutes done regularly beats 30 minutes done once a month. Now let me answer a very common question. Should I do these exercises when my back hurts? Yes, but gently. Movement increases blood flow. Blood flow brings healing. Staying still often makes pain worse. But remember, gentle, controlled movement, not forcing. Another common question is, can I do these exercises if I have arthritis or disc issues? In most cases, yes. These exercises are designed to reduce compression, improve support, and restore natural movement. They are not aggressive. They are not extreme. But always respect your limits. Now let's talk about posture, because posture is silently destroying backs after 60. Modern life pulls us forward. Phones, TV, sitting. Over time, The head moves forward, the shoulders round, and the lower back compensates. This creates constant strain. The spinal lengthening exercise you learned is critical for reversing this. You don't need perfect posture. You need better posture. Even small improvements reduce pain dramatically. Now let me give you a simple daily routine using these exercises. Morning, standing pelvic tilts. Spinal lengthening. This reduces stiffness and prepares your body for the day. Afternoon or evening, hip hinge. Core brace. Balance shift. This reinforces strength and stability. That's it. No equipment. No gym. No floor. Now let's talk about mindset, because mindset determines results. If you expect pain, your brain prepares for pain. If you expect improvement, your body responds differently. This is not imagination. This is neuroscience. Approach these exercises with curiosity, not fear. Ask your body, how does this feel today? What feels easier than yesterday? Those small wins matter. Now I want to speak directly to something emotional. Many people over 60 feel frustrated with their bodies. They feel betrayed. They feel limited. They feel old. But your body is not broken. It has adapted to years of habits. And habits can be changed. Movement is not punishment. Movement is communication. These exercises are a conversation with your body that says, I'm listening. I'm moving with care. I'm rebuilding trust. That's powerful. Now let's talk about something people rarely mention, confidence. Back pain steals confidence. You stop trusting your body. You move less. You shrink your world. When your back feels stronger, confidence returns. You stand taller. You move more freely. You feel younger, not because of age, but because of ability. Ability matters more than age. Now I want to give you one final reminder. Do not compare yourself to others. Your journey is yours. Some days will feel better. Some days will feel harder. That's normal. Progress is not a straight line. But if you keep showing up, even gently, your body will respond. Now let me summarize the most important message of this entire video. Back pain after 60 is not solved by more walking. It is solved by better movement. Movement that supports the spine, restores the hips, activates the core, improves balance, calms the nervous system. These 5 exercises do exactly that. They are simple. They are effective. They are sustainable. And they respect your age without limiting your potential. You are not fragile. You are adaptable. Start today. Move gently. Stay consistent. Your back can feel better than it has in years. And you deserve that.